Hello, I'm Myrtle Pettit, and today we'll be talking about iodine-deficient hypothyroidism. Thyroid disease prevalence impacts 12% of the American population, according to the National Institute of Diabetes and Digestive and Kidney Diseases. It is estimated that 4.6% or 5 in 100 are affected by hypothyroidism. There are 5 different categories of hypothyroidism based on their etiology. Let's find out. Number 1, primary hypothyroidism. In this category, the most common issue is iodine deficiency, followed by iatrogenic cause like radioactive iodide, medications, and surgery. Altogether, they make 95% of the hypothyroidism cases. This also includes autoimmune hypothyroidism, including Hashimoto's disease. Secondary hypothyroidism. This is due to pituitary conditions such as pituitary adenomas and Kitch'n syndrome, and as an aftermath of pituitary surgery, which all this lower the production of TSH, or thyroid stimulating hormone. Tertiary hypothyroidism. As the secondary relates to pituitary, the tertiary hypothyroidism relates to hypothalamus, in which the thyrotropin releasing hormone is reduced, which may be a result of congenital anomaly or other factors. How about transient hypothyroidism? This may result when thyroid hormone therapy is abruptly stopped after long-term use. Subclinical hypothyroidism. Lastly, this refers to people with a normal free T4 but with an elevated TSH. Let's look at the risk factors. Severe iodine deficiency. Globally, there are 1.8 billion people who are iodine deficient, so it is a larger issue than we think. Iodine plays a significant role in the production of thyroid hormones as it attaches to tyrosine, and it depends on how many iodine determines the type of thyroid hormone produced. T1, tyrosine plus 1 iodine. T2, tyrosine plus 2 iodine. T3, tyrosine plus 3 iodine. And T4, tyrosine plus 4 iodine. Moreover, congenital hypothyroidism is primarily a result of the mother's iodine-deficient diet. Interestingly, pregnant mothers who are not deficient in iodine due to iodine supplementation reduce their risk of postpartum hyperthyroidism. And similarly, it can also contribute to postpartum hypothyroidism. Women older than 65 years old. Kellerman and Raquel pointed out that older women has higher risk of hypothyroidism, in which 2 to 3% are affected in the general population, but 5% in older women living in nursing homes. Type 1 diabetes, celiac disease, and other autoimmune disorders. These are listed as risk factors as it relates closely to metabolic syndrome and hypothyroidism. Next, Down syndrome and Turner's syndrome. People with these conditions are likely to manifest hypothyroidism and thereby must be closely monitored and examined early. So now let us go to assessment with a medical and functional assessment, including the famous thyroid panel, TSH, thyroid stimulating hormone. This test is used to determine the thyroid function. High TSH is consistent with primary hypothyroidism. However, chronic hypothyroidism may appear as low TSH. Normal values 0.35 to 6. Free T4 thyroxine. This lab test is ordered to initially determine hyperthyroidism or hypothyroidism in a patient and is also helpful in monitoring the thyroid medication. Normal values 0.8 to 1.8 nanogram per deciliter. Total T4 thyroxine is the inactive thyroid hormone, which is the most abundant of all thyroid hormones. Low T4 shows a sluggish thyroid and poor thyroid activity, while high T4 indicates overactive thyroid and excessive thyroid activity. Normal values 4 to 12 micrograms per deciliter. Free T3 triiodothyronine is known as the inbound active thyroid hormone, which may be low as in the case of primary hypothyroidism or even secondary, and high in the case of hypothyroidism. Normal values 2.3 to 4.2. Total T3 triiodothyronine is the bound and unbound active thyroid hormone, wherein low levels show hypothyroidism and high levels is clinically associated to hyperthyroidism, with the T3 uptake as a determinant whether there is a conversion issue. Normal values 80 to 200 nanogram per deciliter. Reverse T3 is an important thyroid test in determining the conversion of T4 to an active T3, since RT3 or reverse T3 cannot be reconverted back to the active T3. Moreover, elevated level is a factor in determining Graves' disease and hyperthyroidism. Normal values 8 to 25 nanogram per deciliter. Thyroperoxidase antibody, also known as TPO, if elevated, is probably due to autoimmunity and is associated with Graves' disease and Hashimoto's. Normal values below 9 international units per milliliter. For functional tests, there's the 24-hour urine iodine loading test. This test helps determine whether the person is deficient in iodine or not. Iodine is an important mineral for the thyroid function and the production of thyroid hormones. Of course, there are other available adjunct tests by Hakala Labs, including the analysis of bromide, fluoride, and chloride analysis, as these elements are under the halogen group, and so as iodine. But those displace the latter, causing mild to serious effects to the thyroid gland, especially mercury, though not included in the test. Since we've tackled the assessment, let us go to the intervention. Here's the usual medical intervention for hypothyroidism. The following are the recommended prescription for thyroid. T4 100 micrograms levothyroxine, most commonly known as Synthroid, Levoxil, and Unithyroid. T3 20 to 25 micrograms iothyronine, also known as Cytomel. T4 12.5 micrograms plus T4 50 micrograms Lyotrix or Thyrolar. There's also the desiccated thyroid, 1 grain. This is a desiccated porcine thyroid, or from pork. It's also known as Armour thyroid. Integrative and functional therapies. This is a comprehensive list reference from naturopathic, chiropractic, and functional and medical experts whose recommendations have been tested through time based on the literature and the anecdotal experience of their clients. Iodine supplementation list: kelp, 2 grams per day, 5% Lugol solution, 2 to 3 drops applied topically, Dr. Wade's liquid iodine drops with cranberry, L-tyrosine, 500 grams 1 to 3 times a day, selenium, 200 to 400 micrograms per day, zinc, 20 to 30 milligrams per day, copper, 2 to 5 milligrams per day, B complex, 50 to 100 milligrams per day, B2 riboflavin, 15 milligrams per day, B3 niacin, better yet niacinamide, 25 to 50 milligrams per day, B6 pyridoxine, 25 to 50 milligrams per day, vitamin C, 1000 to 1500 milligrams 3 times a day, vitamin E, 400 IU per day, magnesium, 200 to 600 milligrams per day, Coleus forscoli, 1 to 2 ml 3 times a day, Google, 25 milligrams 3 times a day, Hawthorne, 500 milligrams 3 times a day. So these are the list of supplements that most of these functional medicine and integrative experts are giving their patients. Not all of it, but it can be a combination. Iodine and tyrosine support the needed requirement to produce thyroid hormones. Selenium is necessary for the conversion of inactive to active thyroid hormone. And it also works well with vitamin E, while vitamin C is the grandfather of all antioxidants and helps regenerate vitamin E. Zinc is necessary in over 300 enzymatic activities, while copper supplement balance the zinc-copper ratio. How about the B vitamins? B vitamins are crucial in the cellular metabolism of the body and the production of energy. Magnesium helps normalize many of the biochemical processes, reduce inflammation, and is also known as a natural calcium channel blocker. Coleus forscoli, Google, and Hawthorne have been found helpful for people who suffers from hypothyroidism. So here's my hypothesis. Iodine, crucial for balancing the thyroid hormones and thyroid functions in hypothyroidism. Iodine deficiency is the most common etiology or cause of primary hypothyroidism. It is such an important mineral for thyroid optimal and daily function. In some Asian countries, the consumption of seaweed is part of their culinary heritage, a tradition passed on to succeeding generations. This is noticeable in Korean culture with seaweed birthday soup. Yes, there is. Seaweed pregnancy soup, regular seaweed soup, kim, nori seaweed laver, and kimbap, a Korean version of sushi. But this is most emphasized in the Japanese culture, which has the highest consumption of iodine in the world, 1,000 to 3,000 microgram per day, or 1 to 3 grams per day, according to Sava and Sava, due to their seaweed daily consumption. However, Western diet hardly consists of any iodine-rich foods except for garlic, which contains some iodine. Thus, an inclusion of seaweed is important to increase iodine intake, or supplementation of iodine and iodide will improve the deficiency and hypothyroidism. Let's go to nutrition, my favorite topic. Gentle reminders. Number 1, avoid goitrogenic foods as it suppresses thyroid function, so it is best to avoid cruciferous vegetables or brassica family like cabbage, broccoli, cauliflower, kale, mustard greens, Brussels sprouts, and more. but this should be avoided only until the iodine levels are normal or higher than normal. It could also be taken in as long as you take more iodine as a supplementation. Other foods such as millet, cassava, turnips, soybeans, and even flax seeds can also affect the thyroid function too. Arachidosides containing foods like peanuts and foods containing para-aminobenzoic acid or PABA have goitrogenic-like effects. A similar effect is produced when one subscribes to a high-fat diet. And when one takes a lot of calcium. Number 2, avoid nitrates from processed meats as it is goitrogenic too. Number 3, certain foods and beverages must be avoided, such as processed foods, dairy, alcohol, coffee, zero sugar drinks. Those must be avoided. Number 4, avoid foods, beverages, or products with bromide, fluoride, and chloride, as this interfere with thyroid function by blocking iodine. Number 5, eat more iodine-rich foods, most commonly found in seaweeds. Number 6, eat foods like bananas and oats to help support thyroid function, as well as nuts like Brazilian nuts, rich in selenium, pumpkin seeds, rich in zinc, and walnuts, rich in omega-3. Number 7, replace salt with Celtic salt, as it has 82 minerals compared to regular table salt with just 2 minerals, and iodized salt with 3 minerals, or even use Dulse flakes or kelp granules as a salt replacement. Number 8, improve hormonal imbalance by Dr. Schultz female shot or male shot for 3 days. Add maca root for breakfast and drink red clover tea at night to regain the balance. Eat yams rich in phytoestrogen and apply Anna's wild yam cream topically. Number 9, take the non-sparkling Apfer Shorelay to improve lethargy and lack of energy by feeding the Krebs cycle with appropriate nutrients. 8-ounce unfiltered apple cider, which is rich in malic acid. 2 tablespoons of lime juice, which is high in fumarate and citric acid. 2 tablespoons of lemon juice, which is also known for its citric acid. 1 tablespoon of apple cider vinegar with mother, which is rich in oxaloacetate. A note about apple cider vinegar, you can only use this with apple cider vinegar for a week or less. Mix well. You can also add a pinch of cayenne. The original Apfer Shorelay with sparkling or carbonated water was used by the German athletes to improve their performance for the Olympics. Number 10, enjoy a potassium-rich vegetable broth to support adrenal function. Now let's go to physical medicine. Number 1, high-intensity exercise after drinking non-sparkling Apfer Shorelay to generate more ATP. Number 2, cold shower at the end of the morning and evening baths, or directly spray tolerable hot to adrenals just right above the kidneys for 6 minutes and do cold water spray to it for 30 to 60 seconds, which can be applied also as a hot and cold compress and will help boost the adrenals and indirectly help the thyroid gland. Number 3, place a slight wet warm neck compress with Epsom salt and a few pinches of cayenne onto the thyroid area and wrap with a dry scarf around the neck to stimulate the thyroid gland. Detoxification. Number 1, follow closely the International Academy of Oral Medicine and Toxicology IAOMT SMART protocol for amalgam or mercury fillings removal. I will put the link down below. at the description box. Mercury is the biggest competitor of iodine. Since mercury is readily absorbed and stored in the thyroid gland instead of iodine, mercury also has a strong affinity for selenium, an important nutrient for the conversion of T4 to T3. One of the major sources of mercury is the ingestion of mercury fillings. Mercury is toxic, and there is no safe level of it. It is important to keep in mind that the recommended SMART protocol when looking for a dentist to remove the mercury fillings. It must not be done haphazardly because broken pieces of mercury might be ingested or its toxic fumes inhaled. Well, the safest way to determine a candidate dentist is to ask if they still do mercury fillings. And if they still do, they do not understand the risk it entails. Dr. Tom Maguire wrote a book on the subject, The Poison in Your Teeth. Mercury amalgam, silver fillings, hazardous to your health. As recommended by my husband's dentist, Dr. Woods, who follows this protocol closely, he prepares chlorella slurry for his patients before and after the procedure. Other recommendation is the use of activated charcoal slurry. Moreover, mercury is not only found in amalgam fillings, but also in coal-burning power plants, plume, vaccines, pesticides, and cosmetics. Number 2, apply charcoal neck compress to help detoxify the thyroid gland. 1 tablespoon charcoal plus 1 teaspoon of ground flax or chia or psyllium husk plus enough water to make a dough out of it. Flatten it in a cling wrap and transfer it without the plastic to the center of a nicely folded handkerchief, ready to wrap onto the neck. Make sure it is not tight nor loose, but a comfortable fit to be worn all throughout the night. Number 3, cocoa chlorella cilantro drink is my personal concoction as a simple detox drink. 8 ounces of coconut water, 7 to 10 tablets of spirulina chlorella, and 1 cup of loosely packed cilantro. Blend and drink. You can also add more coconut water to improve the taste. Cilantro is one of the most important plants for detoxifying heavy metals. In conclusion, the lack of iodine consumption is a major contributor to hypothyroidism. Other factors such as processed foods, additives, artificial coloring, heavy metals, chemicals, and pesticides even aggravates the condition. The thyroid gland seems neglected when it comes to dietary and supplementary support. This must be given emphasis, especially in Western culture, as eating seaweeds is not inherent. As more and more people face issues of obesity, diabetes, depression, and other similar conditions connected to metabolic processes, care and support must duly be given to this neglected gland. It is one of the most important storage sites for iodine, followed by breast and prostate. And if there is an insufficient supply of iodine, the thyroid is given priority, with the latter being predisposed to cancer. Interestingly, Dr. Brownstein, in his book Iodine, Why We Need It and Why We Can't Live Without It, it showed that when iodine is increased at 100 times or 15 milligrams compared to the RDA, iodine then binds the proteins which synthesize delta-iodolactone. The delta-iodolactone is a powerful anti-cancer substance, a key regulator for abnormal cell death also known as apoptosis. This is the mechanism lost in cancer, and also for thyroid cellular proliferation. Iodine, tyrosine, and selenium are all key nutrients for proper thyroid function, and this work synergistically. Adhering to a diet rich in these nutrients will help supply the daily needs of the thyroid gland and help the thyroid gland recoup. This is Myrtle Pettit from Kitch'nGardens. Choose life, choose health, and choose well. For after all is said and done, it's all about a matter of choice.